So it's not just about, responding when something happens, but through preparedness, through ensuring that prevention is there and doing the right necessary promotion to make sure that stigma is addressed, because the main barrier towards, providing or accessing support, it remains stigma to mental health, problems and conditions. So that is one very strong area that World Vision really focuses on. And also, we make sure that uh, mental health and psychosocial support are not activity based. We make sure that through partnerships with, formal entities, whether those are governments, local authorities, or non-formal partners such as local organizations, faith-based organizations, faith leaders, we are providing them with the right resources that they can really intervene and maintain this relationship with children. Because at the end of the day, yes, World Vision exists within communities and has long existed with communities, but the society is not made up of non-profit organizations and civil society organizations. The systems that are there need to always exist and to be maintained. And for those systems to be maintained, we need to address the gaps that occur whenever an incident happens. And for that to happen, it's not just World Vision, it is a whole collective effort. But usually, what we do is we make sure that we are present as World Vision at all different layers of the social ecology for the child. So, right there in the communities, existing with the families, with the children, providing those programs that are very important to help maintain, first of all, regain recovery, but then uh, help them find a way to reconnect the dots at the community level, but then also strengthen the local, supports that exist within that space, where we look for what already existed. We do not, parachute concepts and projects on communities, which is something very important. We collaborate to see if how things were happening, what was already existing, and what can we do to strengthen that. And then we take the time to learn. It is very important, and we learn from children, and we've been doing it for the past, ever since COVID. We've been doing learning exercises with children. This has been institutionalized within World Vision. The child participation as a right is very important. We take it very seriously. And then once children tell us what is working for them, what is not, we adjust and, amend our both mandates and programming with the resources that we have. But on the other hand, because historically MHPSS area of work has been underfunded, we try as much as possible to advocate that at a both governmental level but also at a global level, MHPSS is prioritized by the donor community, to make sure that it sits where it should sit and how it should sit within all those different sectors. So within education, within social protection, within livelihoods. So this is becoming more evident now, and this is not just World Vision's work. I think it's a collective effort within the space that if we don't do it in such a way, then different important pieces of the chain will, disrupt the whole process, and we will go back to how things, to missing out on opportunities. So for us, a key component in strengthening this process is also working with caregivers, because children don't live in a vacuum. And when caregivers themselves are, overwhelmed and displaced, there is a sense of loss for security, for safety, and their capacity to provide, for their children, both at emotional, social, all those different important levels that they do provide usually with children, gets also affected. So we make sure that the programs also include caregivers, but not only the primary caregivers. We make sure that we include the extended family wherever that type of culture exists in the certain context that we work, because there are some contexts that we all know of where the family is made up of extended family as well. So we try to make sure we're including the extended family as well.